Is detox a fad or is it a fact? Hi, I'm Dr. Chellam, founder of Holistic and Integrative Center of Novi, the best place for you to find your best doctor, and that is always you. I know I post a question in the community about what does detox mean to you, and many of you gave me some very intriguing answers. Some of them were very right, accurate, and of course detox can be detoxing your life, starting from scratch, eating better food, but I'm going to explain the boring version of detox. So let's look at what a detox is. A toxin is a substance that harms you. It is harmful to your cells or harmful to your body. Detoxing is getting rid of this substance that can potentially harm you. And which is the strongest detox organ in our body? That is our liver. And that's what this diagram is all about. The big red, I don't know, it looks like a chili almost. That's your liver. That's my version. This is a meme to help you understand what the detox process looks like. So let's start with what a toxin is. The best way for me to make you understand the toxin is to have these shady characters because they are harmful to you. Now the toxins get into the liver. The liver identifies the toxin, puts them in packages. They go on this conveyor belt. Somebody else monitors that they go to the right place, get to the exit point where they're fully packaged, and these guys determine the next phase. They determine you go through the poop or you go through the pee, basically through the gut or through the kidney, right? That is the normal detox process. So you're basically taking something that can potentially harm you, packaging it right so it doesn't get into the blood but goes through your gut or through your kidney. That's a simple physiological process. What goes through this detoxification? Number one can be excess hormones. If your body is producing hormones because the diet is not right, that can go through this. If you take medications, that can go through this. If you're exposed to chemicals, whether it be makeup, whether it be cleaning material, you could be a hairdresser, you could be working in a gas station, you could be working as a painter. All of these, you've got exposure to chemicals. Now, as normal human beings, we are exposed to the anti-inflammable chemicals on our drywall, on our carpets, the treatment, the grass treatment for pesticides or the pesticides to prevent your grass from getting infected. All of these are chemicals we're exposed to but don't think about. Now, everything goes into your body either through the skin, your lungs, but mostly through your mouth. You ingest a lot of this. Your drive-through, right? You coming back from work, you don't have time to cook. Let's go through McDonald's or let's go through Taco Bell and get something. You actually choose the most healthier version of these foods, bring it home. The liver is supposed to sort all this out. Its job is to process the food that comes from the broken down products from the gut to the liver. The liver looks at it and says, you are nourishment, you are toxin, you need to get out of the body and you need to get into the body. Just like the Border Security Patrol looks at all the people coming in, you're tourist or you're terrorist. And if a whole bunch of people come in, it's going to slow down the process. And that's what happens at the liver level too. When you consume too many of the junk foods or you're exposed to too many chemicals, the liver is beginning to sort this out and it can get overwhelmed and fat. That's the fatty liver. Or it can get overwhelmed and sluggish. And how do we know that? From a medical standpoint, we look for increased ferritin. From a patient standpoint, you're looking at your symptoms. Do you have headaches? Do you have chronic pain? Do you have a bloating sensation in your stomach? Do you feel sluggish? Do you have unbelievable fatigue and you have no idea why you're fatigued? You seem to be eating normally, drinking water, but you just cannot seem to get over this. Could you be exposed to mold on a constant basis in your home? Could you be exposed to some kind of chemical in your workplace? These are the things that we have to look at if you're having all those symptoms. particularly where you are aging faster or you are losing steam faster. So then we look at this phase and see what could be the process. Is there too much load into the liver? Are you consuming too much of junk or exposed to too much of junk? Or let's look at the reaction. I told you it packages it. During the packaging, it needs the support of a few vitamins and minerals. B vitamins, vitamin A, C, and E, minerals, glutathione, all these, might be Greek and Latin to you, but let me tell you, we got to test for these things to make sure you have enough of those. Because two things happen when they're packaging. As they're packaging and they're cutting all these packages to make it the right size, there's a lot of waste material. The waste material is called superoxide. It's a very unstable oxygen that can cause cell damage. So it needs to get flushed right away. The flushing happens when you have enough of vitamin A, C, and E, when you have selenium, copper, zinc, and manganese, and if you eat a lot of cruciferous vegetables. We keep repeating that over and over again. So either you're not flushing all of the waste products of the toxins getting processed, or you don't have enough the vitamins to help these toxins to be processed. That can lead to damage to the liver or congestion of the liver. The other aspect that you have to keep in mind is it goes through this process. So in between, as you're slicing and dicing these toxins, you can see these characters in the conveyor belt are what we call intermediary products. That means they are not fully ready to be flushed down, either through the gut or the kidneys, but at the same time, they are not like they came in originally. We've already made some changes to them. Now they actually become more potent. Particularly an example is estrogen. Estrogen, as it gets broken down, becomes more potent, and if genetically your enzyme is deficient to actually get this in the right direction, or you have metabolic abnormality like insulin resistance, or in other words, that means you're not processing sugar well, or your liver is congested, these estrogens can be so powerful, they can actually increase your incidence for breast cancer. So once again, to tell you, as they are packaging, 3 phases, let's look at it as 3 phases. First phase is identifying, putting them in packages. Next phase is getting them to the third phase. And that second phase, they can actually be very malignant and cause more harm. So if you lack an enzyme or you have what we call metabolic abnormality, your health is not really good, you can potentially be at a risk for cancers. Now the third phase is what we call conjugation. That means we're trying to package them really tight so they get into your gut or in your kidney. Though that phase also needs few substances like glycine, taurine, glutamine, N-acetylcysteine, cysteine, and methionine. If you have a deficiency of these, which are connected to the vitamins too, and your absorption process, that process of eliminating the toxins can become backlogged. So again, how do you know if you have a problem and you need to actually go through a detox? If you have any symptom, you have heartburn, you have a sluggish bowel, you have irritable bowel, you have fatigue, you have hair loss, you have chronic pain, you need to consider getting these tests done and getting a detox done. I hope that helps you. So let me tell you, detox is not a fad. It is a fact. Sometimes when you have these symptoms and all your blood tests come back normal, you need to dig deeper to see what are we missing and how can we actually fix it. Hope that is helpful to you. I am Dr. Chellam, once again, founder of Holistic and Integrative Center of Novi, the best place for you to find your best doctor, and which will always be you.